Dr. Zakir, Senior ENT Consultant. So, we are going to discuss about nasal glioma. So, the better terminology, the new terminology is glial heterotopia. That is a new terminology. So, when you see this picture, you will understand better. Nasal glioma, it means there is a small growth from the brain. There is a brain tissue. Glioma is a brain cell, the brain which is protruding into the nose. So, if you ask me, is there a brain tissue inside this? The answer is no, there is no brain tissue. So, is there a connection with the brain? Yes, there is a thread-like fibrous connection. There is a thread-like fibrous connection only, and this size can be bigger also. Depending upon the size, the newborn baby will have complaints. Now, like how I have explained, glioma is a congenital condition. It is similar to encephalocele, which means suppose this polyp has got a brain tissue inside this and direct connection with the brain, it is called as encephalocele. This condition, there is no brain tissue. So, glioma is a congenital condition similar to encephalocele, but it has lost the intracranial connection, does not contain any brain tissue, but it is connected by a small stalk to the meninges, just like how I have shown in this picture. So, this contains mainly the glial cells and the fibrous tissue. It can be of two types. When it presents inside the nose, it is called nasal type. When it is seen outside the nose, it is called extranasal type. So, depending upon the size of that polyp, the child can present with a nasal block, means breathing difficulty. They have breathing difficulty because the nose is blocked. Newborn babies, they are obligate nasal breathers. So, they can breathe only through the nose. If the nose is blocked, they do not know that they have to open the mouth and breathe. That reflex has not developed in them. So, they are obligate nasal breathers. So, if it is the size of the polyp is big, the nose will be blocked and they will have breathing difficulty. So, we will put a small endoscope and we will have a look. We have a pediatric endoscope, nasal endoscope, 2.1 size, and we will find there is a reddish nasal mass which is firm, and when the child cries, this nasal polyp does not increase in size, means there is no brain tissue connection with that. We would like to do an MRI scan to reconfirm the diagnosis, and once the diagnosis is confirmed, the main treatment for this is going to be complete surgical excision. That is how we manage nasal glioma. Thank you.